Uptravi, Selexipag uses, side effects and how it works. What is Uptravi, Selexipag? Uptravi, also known by its generic name Selexipag, is a prescription medication used to treat pulmonary arterial hypertension, PAH, a type of high blood pressure that affects the arteries in the lungs and the right side of the heart. Selexipag belongs to a class of drugs called prostacyclin receptor agonists. It helps prevent the progression of PAH and reduces the risk of hospitalization caused by worsening symptoms. Uptravi, Selexipag, is typically taken by mouth twice daily. For patients unable to take oral medication, an intravenous form is available. The most frequently reported side effects include headache, diarrhea, and nausea. What is Uptravi, Selexipag used for? Uptravi, Selexipag, is specifically approved for the treatment of pulmonary arterial hypertension, PAH, a serious and progressive condition in which the blood vessels in the lungs become narrowed and stiff. By targeting this underlying issue, Selexipag helps to lower the blood pressure in the lungs, improve oxygen delivery throughout the body, enhance your ability to breathe and exercise more comfortably. How does Uptravi, Selexipag work? Selexipag works by mimicking the action of prostacyclin, a natural substance produced in the body that helps relax and widen blood vessels. By activating prostacyclin receptors, Uptravi causes the blood vessels in the lungs to dilate, reducing the strain on the heart and allowing blood to flow more freely. This process helps decrease pulmonary blood pressure, improves heart function, and makes it easier for the body to receive oxygen. What are the side effects of Uptravi, Selexipag? Like all medications, Uptravi, Selexipag may cause side effects. Most are mild to moderate and may improve as your body adjusts to the treatment. If symptoms persist or worsen, contact your healthcare provider. Common side effects include headache, reported in about 65% of patients, diarrhea 42%, nausea 33%, jaw pain 26%, vomiting 18%, pain in the arms or legs 17%, muscle pain 16%, flushing 12%. Other possible side effects include joint pain, low appetite, anemia, low red blood cell count, low blood pressure which may cause dizziness, lightheadedness or fainting. Typical dosing for Uptravi, Selexipag. The usual starting dose of Uptravi, Selexipag, is 200 micrograms mcg taken by mouth twice daily, approximately 12 hours apart. Your healthcare provider will gradually increase your dose, usually by 200 micrograms twice a day, until the highest dose you can comfortably tolerate is reached. The maximum recommended dose is 1,600 micrograms twice daily. Dose adjustments are made slowly to help your body adapt and to minimize potential side effects such as headache, nausea, or jaw pain. Your individual dose may vary based on your medical condition, liver function, and other medications you may be taking. For example, people with liver problems may require lower doses. Certain drugs can also interact with Selexipag, Uptravi, and affect how it works in your body. These include clopidogrel, Plavix, rifampin, Rifidin. Always tell your healthcare provider about all medications, supplements, and herbal products you are using before starting treatment with Uptravi. For patients who are unable to take oral medication, Uptravi, Selexipag, is also available as an intravenous, for infusion. This form is administered by a healthcare professional in a hospital or clinical setting. Uptravi, Selexipag. Contraindications. Contraindications are specific medical conditions or situations in which you should not take Uptravi, Selexipag, due to potential safety risks. Before starting treatment, it is essential to inform your healthcare provider about your full medical history and any current medications. You should not use Uptravi, Selexipag if you are taking certain medications that interact with Selexipag, such as gemfibrozil, Lopid, which can significantly increase Selexipag levels in the blood and lead to serious side effects. If you have any other health concerns, such as severe liver disease or a history of drug interactions, your provider will assess whether Selexipag is safe for you and may adjust your treatment plan accordingly. Pharmacist tips for Uptravi, Selexipag. When taking Uptravi, Selexipag, following your pharmacist's and healthcare provider's instructions carefully is essential to ensure safe and effective treatment for pulmonary arterial hypertension, PAH. 1. How to take Uptravi, Selexipag. You can take Uptravi, Selexipag, with or without food. However, taking it with food can help reduce stomach-related side effects such as nausea, vomiting, or diarrhea. Always swallow the tablets whole with water. Do not split, crush, or chew them, as doing so can alter how the medication is absorbed by your body. 2. What to do if you miss a dose. If you miss a dose and your next scheduled dose is more than 6 hours away, take the missed dose as soon as you remember. If your next dose is less than 6 hours away, skip the missed dose and resume your normal dosing schedule. Do not double up on doses to make up for a missed one. If you've missed doses for 3 days or more, contact your healthcare provider before restarting the medication. You may need to restart Uptravi, Selexipag, at a lower dose to reduce the risk of side effects. 3. Important medication safety reminders. Uptravi, Selexipag, can interact with other medications, including prescription drugs, over-the-counter products, and dietary supplements. Always inform your doctor and pharmacist about everything you're taking. Do not start or stop any medication while using Selexipag without professional guidance, as interactions may affect your treatment safety and effectiveness. 4. Use during pregnancy and breastfeeding. If you're pregnant, planning to become pregnant, or breastfeeding, talk to your healthcare provider before taking Uptravi, Selexipag. There haven't been enough studies to confirm its safety during pregnancy or breastfeeding in humans. Although animal studies showed no harm to unborn offspring, these findings may not fully apply to humans. Your provider will evaluate the potential risks and benefits to help determine the best course of action for you and your baby. Uptravi, Selexipag, is an effective treatment for pulmonary arterial hypertension, PAH, when taken correctly and consistently. Always follow your healthcare provider's instructions, communicate openly about any side effects, and keep your care team informed about all the medications you're using. Taking these precautions will help you get the most benefit from your Selexipag treatment while minimizing risks. If you found this video helpful, don't forget to like, subscribe, and turn on notifications so you never miss the latest updates on prescription medications and health insights. Share this video with someone who may benefit from learning more about Uptravi, Selexipag, and let's make trusted health information accessible to everyone.